I welcome all the doctors today to the 1366th the International Platform for Promoting Homeopathy. And today we have a very senior guest with us today. Before starting the webinar, let's take a 2-minute silence. Okay, so we have a very senior guest with us today. And our guest today is Dr. SAMIR Bhattacharya. He has been the professor and HOD of Materia Medica department at the National Institute of Homeopathy, and also the ex-director of National Institute of Homeopathy. He has also been a guide to the PhD students in their thesis, and he has given various classes to students in India and also overseas in America. So we welcome Dr. SAMIR Bhattacharya. Are you here, sir?
Again.
Hello.
It is here.
Yes, yes. Yes.
Dr. Bhattacharya, kindly
Unmute, sir.
kindly unmute yourself, sir. Dr. Bhattacharya, sir. Please unmute yourself, sir. You can unmute yourself, sir. Sir, you can start, sir.
Yes, sir. So we welcome Dr. SAMIR Bhattacharya, sir. Sir, you can start your session and share.
Sir is joining again. Nehaji, you have to
Okay, sir.
make him. He joining again. You
Okay,
have to
sir.
make. You have to make him the host.
Okay, sir.
Please wait for him to join.
He is not yet joined. Yes, Dr. Ganesh was saying something, I guess, sir.
Yes, so, sir can make a small speech on these pediatric cases. Our guest is joined, or otherwise we can have a discussion on the same. That's the way we can manage till the sir joining.
Yes, sir.
Whether the sir is joined or not.
He's joining. He's not yet joined, sir. Again.
And sometimes the network may be weak. That's the reason why we are not able to hear.
Yeah, maybe, sir.
Sorry.
Dr. Ganesh can be made the co-host, no? Dr. Neha?
Yes, sir.
You can make him the co-host so that he can unmute himself.
Yes. I've made him the post. Yes, sir.
Yes. Whether sir has joined?
Not yet.
Not yet.
Yeah.
Today's discussion is about pediatric cases, I think.
Yes. Yes. Pediatric cases are a good area to be handled by homeopathy, and nowadays there are many diseases which can be very well catered with homeopathy, because many psychological problems are also coming up with kids nowadays. Like we had also mentioned in our previous webinars, like ADHD, autism, and anxiety attacks are also getting very common in kids nowadays due to the excessive pressure on them about the studies or about how to perform in the school and even in the extracurricular activities. So there is an increasing pressure on the kids, and many kids are coming with more and more of psychological problems. Obviously, we have the physical set of problems also, like growth problems and tonsillitis, and other areas where kids need attention. But psychological problems are on the increase, especially nowadays, and even the allergies, because kids are not getting exposed to the natural environment nowadays. They are more into closed environment. They are mostly sitting in the ACs. The kids are growing up in a very comfortable environment, extra comfortable environment with a lot of amenities, but their natural immunity and natural ways to get the things we used to do previously, like kids used to play in the park previously, and they used to go for other physical activities, more of them. So those things are not happening nowadays, and so that is leading to more development of allergies and many psychological
Dr. Neha,
problems. Yes, sir.
Dr. Neha, he has joined now.
Yes, sir.
He has joined. You have to make him the
Yes,
host.
sir. Yes, I had made him the
Yes.
host. Yes, sir.
Yes, sir.
So we have Dr. Bhattacharya with us now again.
Please unmute yourself, sir.
Hello, Dr. Bhattacharya.
Hello.
Hello, sir. Are you able to hear us, sir?
Yeah, you are audible, sir. You are audible, sir. Now,
Oh, now I am trying with my mobile.
now
Yeah,
it
yes.
is okay, sir. You can start, sir.
Okay.
You can start, sir.
Yes, sir.
Okay.
Again, I would like to introduce Dr. Bhattacharya, sir. He has been the ex-director and HOD of Materia Medica at the National Institute of Homeopathy. And we are very privileged to have such a senior member with us today. And I would like to invite him for the webinar today on the pediatric cases and role of homeopathy in them. So welcome, Dr. SAMIR Bhattacharya, sir. So you can start your session by sharing the screen, sir.
Good evening,
Yes, sir.
everybody. I am thankful to Dr. Sahani, who has invited me to speak before you in the particular topics, homeopathy in pediatric disorders. Nowadays, when CCH, it was CCH earlier, now it is National Commission for Homeopathy, but earlier the CCH, Central Council of Homeopathy, which started MD Home, they started pediatric medicine in MD Home. So now there are so many experts in the field of pediatrics have come to homeopathy. But earlier, when we were the students, there was no specialization course, not even graduation course. Only some diploma courses were there. Still that time we found on the notice board or the chamber's signboard, doctors used to write that he is the specialist in children's disease, old diseases, that is chronic diseases, and the female diseases. So it was believed not only by the doctors, homeopathic doctors, but it was believed by the common people also that homeopathy is best for the diseases of the children. And we have seen that in most of the difficult cases also, people used to bring their children to the homeopathic doctors for treatment when there was no answer from the allopathic side or modern medicine side. Now, understand, in one hand, homeopathy was believed to be the best treatment of the children's, infants. On the other hand, in our classes, we used to taught that homeopathic treatment can only be successful if you depend on the general symptoms, that is mostly the subjective symptoms narrated by the patient. And here, your patient is a child who cannot narrate his complaints. So what is the difficulty? And to overrule that difficulty, we have seen our stalwarts are mostly depending on the objective symptoms elicited by the physician or elicited by the parents of the patient and narrated to the physician. So, for treatment of the children, the pediatric diseases, it was the most important role of the objective symptoms, symptoms either observed by the physician or narrated by the patient's party to the physician. So that is a very difficult task. And to understand that, a physician will have to be very much attentive while observing the patient in his diseased condition, because our patient is a child who cannot narrate his subjective symptoms, who cannot narrate the nature of pain he is feeling, who cannot narrate his mental symptoms. But we have to observe the child and we have to find out the symptoms, though it is not that all patients in this department will not be able to speak, because the pediatric disease, actually, we consider that earlier it was being considered that 0 to 18 years of age was the domain of the pediatric diseases. Later on, it was changed. It came 0 to 21 year of the age. Again, it was changed. And ultimately, it was decided that no such limitation of the age will be there. It will start from 0, but it will end till the patient becomes adult, comes to the adulthood and take care of himself. Up to that level, he will be considered as the pediatric case. So, this stage, only thing the physician needs, that is the observation. I can tell you few patient so that you can understand what is the need of the physician to deal with these pediatric cases. I want to quote a case of Dr. B.N. Chakraborty. I was a teacher at that stage in National Institute of Homeopathy, where Dr. B.N. Chakraborty narrated this case that a patient came to him, a child who cannot even speak, that stage, and he was suffering from a very tedious symptoms of diarrhea, different types of stool and diarrhea. And the patient was treated by so many doctors, but nobody could make any remedy to the patient. At that stage, Dr. B.N. Chakraborty, just on curiosity, he was just looking on the patient and he found that at the rectum there was a red glossy area surrounding the rectum, and he translated it as the congestion of the single part, and he prescribed a single dose of sulfur 30, and the child was cured. Not only Dr. B.N. Chakraborty, I am telling about one of my patient. A child was suffering from a chronic complaints. There was lots of symptoms of the respiratory tract, and the patient was growing age, but not physically. The patient was not improving physically. Body was in a marasmus condition, though he was taking his foods generally, normally. Now, in this particular case, I observed one thing, that there is a strong ammoniacal smell in the urine of the patient. So this was my observation. Strong ammoniacal smell in the urine of the patient. And as you know, the strong ammoniacal smell in a child, in adult there are so many medicines, but when it is in a child, the iodium is a medicine which cures it, and a single dose of iodium 200 was given, and the patient was completely cured. So long I was hearing that Dr. Sahani and some other doctors, they were discussing about sepia in adult. I want to tell you one patient where I found that child was brought to me for some constitutional treatment, and I found that the child is not mentally a normal. Strong apathetic tendency in the child, strongly apathetic, and with a strong smell like cat's urine. And in that case, I prescribed a dose of sepia 30, single dose, and the patient was completely cured gradually. It took time, but gradually that cat's like urine smell was removed. Gradually the patient's mental aspects were improved, and the patient was cured. Why I tell these things? Because while we read our Materia Medica, we find many symptoms like this. Strong indication which is related to child or related to other patients also. But a strong observation is required in case of treatment of the children. Now, for treatment of the children, one thing, the patient position, the position of the patient, the child, what he is doing, how he is lying, how he is crying, all these things are very much important and to be observed very carefully to understand the child. So here I am giving you some observations of myself which helped me in treatment of the patients. Now you have seen in many cases the child was brought to you, and there was some, you observed many things, but some suddenly your observation came into the teeth of the child. And you find that there is caries as soon as the teeth appears, it is going to be caries. Decayed. Here you can think of creosote and staphysaxia. Caries at the edge of the gum, calcarea card, syphilinum, Kuja. Caries at the root, Kuja. Now, regarding the serrated teeth, you know, many patients, when comes to you, particularly in modern age, the patient comes that he does not recover from his cold very promptly, and gradually he is again and again suffering from cold. There is obstruction of the nose, nasal obstruction is there, and the teeth of the patient is becoming very much irregular. It is reappearing, appearing and reappearing very irregularly, irregular shape in the teeth. Now, I have observed these children are usually sufferers from adenoid disorders. Their teeth become irregular. Their teeth become irregular, and they habitually suffer from common cold, nasal obstructions, and usually they are taken, when they are taken to the pediatricians, allopathic side, modern medicines, they are given initially some medicines. Gradually this cold settles to the chest and they suffer from some bronchial symptoms, and nowadays very oftenly they are doing nebulizing and some other methods, and the patient becomes gradually affected to it. Many patients, not a single one, I am telling you, when I see such type of irregular appearance of the teeth, usually in initial stage, I prescribe Agraphis nutans, and I have seen it responds well. And then it requires sometimes a dose of tuberculinum, sometimes a dose of tuberculinum bovinum, or similar medicines. Now, sometimes we find their teeth is serrated. On observing this, we come to a conclusion that this type of serration of teeth in newborn or in children, either it will call for syphilinum, or it will call for medorinum or tuberculinum. So these observations will lead you to think certain cases with some certain typical type of homeopathic medicine. Now, if you come to a conclusion that these are the medicines may covers the symptoms of the patient, then it will be very easy to observe you gradually the patient. Now, the patient's posture. I have seen many patients, children, I went to see the case. The patient is constantly touching the umbilicus or touching the nose of the patient. This touching the umbilicus or touching the nose of the patient, usually I prescribe Sina in high potency, not 30, not 6, not even 200. I prescribe their high potency, either 1 m or 10 m. I have seen, because the children and the old age patients, they have got the maximum susceptibility, hypersensibility towards the medicine. So here we usually prescribe high doses of medicine. A single dose of Sina 10 m or single dose of Sina 1 m usually relieves the patient. Now, some patients, child, we have seen that in sleeping position, he is keeping the hands of the abdomen, hands on the abdomen, or over the head. A child is sleeping, as if one adult is sleeping, just putting the hand on the head, or putting the head, both the hands on the abdomen. This patient, usually, if you find, you will see that pulsatilla will be indicated also with some other symptoms. A child, if you have gone and saw the patient is sleeping, just crossing the legs are crossed, and the patient is sleeping, you will see that this child's perspiration has an odor of spicy odor in the perspiration. You can safely prescribe a single dose of rhododendron in such patients. Child sleeping with the limbs apart in both sides. Limbs are apart. Both the legs are apart. Hands are apart. You can think that the child may call for chamomilla. Definitely, on one symptoms, we are not going to prescribe. But with these symptoms, we can find out other symptoms and prescribe chamomilla. Limbs drawn up on the abdomen, drawn up, not kept, folded, drawn up on the abdomen. Mark cord is usually indicated in such case. Many female child I have seen, not infant, but children, who cannot narrate their complaints, but can speak. At that stage, many female child I have seen constantly touching the genitalia, constantly scratching the genitalia, but there is no eruption. Without eruption, they are constantly touching or constantly scratching at the genitalia. I always think for caladium in such cases, because we know that the child are prone to the pinworms, and once there is infestation of the pinworms that comes out in the night in the rectum to lay the eggs, and they migrate to the genitalia and produces itching there, and the child develops the habit of scratching the genitalia, and you can easily think of caladium. Now, these are some observations I have narrated. Now, another thing I am telling you, the common symptoms which comes to us, homeopathic doctors, initially, nowadays, it is very frequent that the acute manifestations of common cold, usually they come to the homeopathic doctors. Even if you are a prescriber of the chronic diseases and you treat many chronic diseases, you have got a good name, fame, but still this type of acute patients will come to you. And in such case, this acute cold, in case of children, the very common medicines I have seen, aconite, ipecac, bryonia, belladonna, calamine, and justicia adodata. I am telling you some symptoms of this type of medicines. Aconite comes usually in the winter season. Or nowadays, due to this AC, air conditioning machine, the parents are enjoying the AC, but the children is suffering from the AC. As a result, there is acute cough of single paroxysms or a successive paroxysms. The patient is coughing and you can very safely prescribe 1 or 2 single dose or 2 doses of aconite in 6 potency I have seen. It is acting very nicely. A single dose or a double dose can cure the cough stage of the patient. Now, another thing, very often we find that the child has been brought to you with some rattling sound in the chest and cough. During cough, there is vomiting. Very often we have seen that ipecac is a medicine which is giving very good result. Now, suppose the cough, sometimes what happens, the patient is outside my clinic in the sitting area. The patient is there, sitting there. I find some cough. If it's some baby is coughing, I follow the sound of the cough. And by following, I have adjusted my ear, and everybody can do this adjustment. By following the sound of the cough, you can understand that this cough is coming from the throat, this cough is coming from the chest, or this cough sometimes is coming from the abdomen. By just adjusting your sense of hearing, you can understand. Now, when I find there is a deep cough coming from the abdomen, I ask, when the patient comes to me, I ask, what is the condition of his bowel movement? And very often I have seen that it calls for Nax Bhumika. Now, when the patient tells that the cough, he has got the cough, and I find that the cough sound is coming from the throat. It is a throat cough. Then I follow the paroxysms. If I follow that there is 1 paroxysm or 2 paroxysms, successions of paroxysm, 1 or 2, I usually think for mercurius. Now, if I find that the child is coughing constantly, one after one cough, as if he is swallowing something, and the child is exposed to damp air, opening of window, usually I have seen this type of throat cough with, after a cough, there is a swallowing of the cough patient, not the cough, but the child swallows it. So I understand this is from some inflammatory process in the throat, and my prescription is usually Phytolacta 30. Sometimes, if the patient cries after it, then definitely you will have to observe when he is crying after cough. Now, as soon as there is cough, by swallowing he is crying, you can think of Hippas sulfur. And if after some time, that means the pain refers to the ear, then he is crying, then again you can think of the Phytolacta. Now, a child is constantly coughing as if there is some dry cough, but you find some nasal discharge. Definitely, I will think for two medicines. One is Calimute and other is Justicia adodata. In Justicia adodata, there will be cough as if something settled in the chest. There is cough settled in the chest, and there is some little nasal discharge. So my prescription will be Justicia adodata 30. And when I will find that there is some nasal discharge and too dry cough, I will see the tongue, and definitely if there is some white coating, my prescription will be Calimute 6, a single dose. Now, tendency to take cold in children. There are certain medicines I have already told you, repeated tendency to take cold. Definitely, a medicine is Calcarea card, particularly at the age after the teething stage has started, and it continues long. 2-3 years the child may suffer from this. We have seen that this type of child, they are very much intelligent. They are prone to more mental work, less physical work, does not like to play by physical exertions, but they will like to play sitting, playful, sitting by computer games, by mobile games, by some other building up some that is, there are different types of play materials. They will construct the house, they will construct the building, they will construct some thing. So this type of game they are indulging. Definitely, the medicine comes here is Calcarea card. And the same child, same age, with both the Calcarea card, Varieta card, both of them has got the inflammation at the tonsils. Sometimes formation of quinsy, painful, like Hippas. But the basic difference will be in Calcarea card, it is more intelligent, and in Varieta card, it is idiotic little bit. Not always every child will be fully idiotic to prescribe, to get a dose of Varieta card. Sometimes little intelligence. But one thing, Calcarea carb, I told, it is playful, self-willed. Whatever he will think, he will do. He will not argue with you. The child will not argue. The child will listen whatever you are telling. Peacefully he will listen to you. Smile and promise that he will do. But ultimately he will not do what you say. He is self-willed person, self-willed patient, calcareous. But here in Banaitaka, it is not self-willed, rather it is foolish. And in calcareous, it is playful, whereas in Banaitaka, the child is aversion to play, will not like to play. All the same in the school, in the field, all the children, they are playing. But one child is not playing, sitting at the corner and waiting till the game period is over. And that child is a Baraitaka child. So these are the things we can think of different medicine. Now I told you about the tonsillitis. I have seen many cases of tonsillitis. Definitely everybody of you have treated and you have cured Hippas sulfur, mercurius, phytolacca. Now I will tell one or two medicines of my own. One is Calcarea floricum, where the patient has constantly, for the long time, suffering from tonsillitis. Never it is reduced. Usually in other cases, in calcarea, in Hippas sulfur, in Maxol, when it is inflamed, it will swell and it will cover the entire throat. But after some times, it will be shrinked and come to the normal after your treatment, and it will be clear. There will be no obstruction in the throat. But certain patients who, even when there is no acute exacerbation, it has gone to the chronic stage, and the tonsil symptoms are not there, no pain is there. But what happens? The tonsils from the both sides covering the whole throat. The patient is telling, no, I have no tonsillitis now. I have no pain now. I don't have tonsillitis. The patient guardian will tell, no, he is not suffering from tonsillitis. You examine and you see that both the fauces are fully covered by a tonsil which is not inflammatory acutely. Try with a single dose of calcarea floor, either 200 or 1 m or higher. Gradually, you will find that stage which was fully occupying the fauces, it will gradually sink up and the patient will get relief. Now, another symptoms. Some patients.
Excuse me, sir, Samir sir.
Yes.
Sir, we have 10 minutes remaining and we need to keep 5 minutes for the question answer session also, sir. Sir, you can have...
Okay, no problem.
Yes, sir. You have 5
Now,
minutes more, sir. You can speak 5 minutes more.
Okay,
For
no
5
problem,
minutes
no
you can have-
problem.
Okay,
Now,
thank you, sir.
Now, another thing, there is fiery redness in the tonsil area. Usually, you know belladonna, but one medicine I am telling you, streptococcin, particularly I use in dose of 30, potency of 30, a single dose, 1 or 2, in such cases where there is red, velvety red color in the throat. And there is gross sign of inflammation. Streptococcin. And just opposite, there is no gross sign of inflammation, but there are pockets of pus in the tonsil. I have prescribed many cases staphylococcin 30. So when there is gross redness, velvety redness in the throat, streptococcin. When there is patchy areas of pus formation, we think of staphylococcin. Now, I have talked so long on the acute, on some acute manifestations. Now, as the time is very limited, just I want to mention some cases which I have come across during my practice. That is most common diseases in the children now. There are certain, that is cerebral palsy, attention deficit, hyperactive disorder, Down syndrome, and idiocy. These are the three. I am not discussing about the symptomatology, causations, everything. But what I want to mean, these are the cases where we have got many homeopathic medicines which act very nicely. I have seen the patients are improving. And as those medicines are usually rarely used in such cases, I want to name one is Ithuja synapium. In many cases, I have seen that it gives improvement. I cannot say it is going to cure. Some medicine I just mentioned, I will not discuss this. Aurum metallicum. One important medicine I am telling you, hydrophobinum, is a very good important medicine in such cases. I have repeatedly found it that it is curing. And definitely Maxol, sulfur, these are some medicines which have improved the cases. I cannot say that these has cured fully, because these cases are not cured fully. But it improves the mental stage of the patient and allow the patient to at least run his life. Normal sensations, normal senses, normal livelihood can be borne by the patient. So these are the stages, the medicines which has acted very nicely in such conditions. Okay, I'm sorry that initially my laptop, I tried to come to you by laptop, but I could not, it was not working. But then I came with this mobile, and I was definitely late for some time, and I could not tell the entire thing what I wanted to tell before you.
Yes.
Thank you for patience hearing, and if there is any question you can ask, I shall try to answer.
Yes.
Thank you.
Yes, sir. It was a very wonderful session from you, sir. A bit things happened a bit sadly. That is maybe due to the network, but your session was excellent, sir. And we have many people raising their hands. We have Dr. Dhanesh, sir. So you can unmute and.
Yes, sir. Good evening, sir. It's really a very good session. You really show the beauty of observation. Particularly while treating pediatric cases, we need to look into the a child or the bystanders, what the child is, how the child is reacting, what are the smell coming out of from the whether it is coming from the mouth or urine or stool, whatever may be. You need to look into all those aspects in cases. So that's the beauty, sir. Since the time is less, I would like to ask a simple thing, sir. Sir, can you continue the same session tomorrow, sir? Because we want you.
Actually, I am telling you, I am now not able to speak for long time because of my throat problem. So, and today I will talk. I will definitely come and speak on some topics after some times. But
No,
these
sir. Sir, we would like to have a discussion with you. You can simply sit and answer. We will ask questions.
that can be done. That can be done. But what's the time? That is the
Tomorrow it's still the same time, sir. Because tomorrow the same time, sir.
what time?
8 to 9 p.m., sir.
Okay.
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 Okay, we can.
Whatever you want to discuss, I will discuss with you tomorrow.
Sir told that there are some more things you want to share with us. And after sharing that, we can 10 to 15 minutes or whatever time you require, you can say about the thing, and then we can have a discussion, because we are lack of time, only 2 to 3 minutes remaining, and most of the doctors want to have a question also. Really excellent session there. Okay, sir, we can confirm.
Yes, Dr. Hubert De Silva also want to say something, sir. Yes, sir.
It was a very nice presentation, and your experience, that is great for us to, we youngsters feel very nice to hearing from you. Sir, I want to ask you, sir, for nasal polyp, what is your experience with the homeopathic medicine?
Nails are falling.
Polypus.
Polyp.
Nasal, yeah.
Polyp.
That's right. Yeah.
Polyp where? Nasal polyp.
Yeah.
Nasal polyp.
Yeah.
You see, there are many medicines, but one medicine I am telling you, I have got a very outstanding result in a nasal polyp that I am just quoting. There are so many medicines you have seen. Timcrium, meram is a very good medicine, and usually I use it and get result out of. Now another medicine I usually use and get this improvement, that is Sanguinaria canadensis. But one case particularly, there was nasal polyp with crust formation. There is nasal polyp with crust formation, and when the crust used to come, there was severe hemorrhage from the nose. And that particular patient, it was treated by some of followers in homeopathy also, and my teachers also there. But ultimately, when the patient came to me, I treated the case with Sanguinaria nitricum 30. And definitely,
Yes,
it was very good result from Sanguinaria nitricum 30.
Yeah. We can have more questions from Dr. Samir sir. Actually, we are having our limitation of time.
Okay, no problem.
Thank you, sir. Thank you, sir.
I hope Dr. Hubert is satisfied. Otherwise, we can have tomorrow again. We will be having the session, so people can ask the questions again tomorrow. And I would like to thank
actually, rather than this type of speech, I will request you to come with some definite questions.
Yes, sir.
I will try to answer these questions, and even my WhatsApp number. It will be better if you can send the questions earlier. I will be prepared to answer you very systematically. That will be better. If you have got any definite question, any problem you have faced, and which even I may learn from that.
Yes, sir.
It is not that you will learn from me, but I shall also learn. Even today, I learn from my students.
Yes. So now I would request Dr. Manoj sir to say the vote of thanks, sir, please. Dr. Manoj.
Thank you, Dr. Neha. It's a wonderful session, and we are very happy that will be continued tomorrow. On behalf of IFPH, I'm expressing sincere thanks, Dr. SAMIR Kumar Bhattacharya. Thanks all for the participation also. Thank you.
Thank you.
Yes, thank you, sir. And we will hope to see you again, sir, tomorrow. And people can come up with their questions tomorrow. and sir will obviously guide us and inspire us with his knowledge. Thank you, Dr. Samir sir. Now I would like to hand over the